Dr. Wazen. I came in today because I've got this ringing noise in my ears. I hear it all the time. No one else can hear it. It's driving me crazy. What's wrong with me?
This is called tinnitus. Some people call it tinnitus. It doesn't matter. It is noise that you hear that nobody else can. It's not coming from the outside. It's coming from inside your inner ear or inside your head.
Can tinnitus be cured?
It depends on the cause. There are certain types of tinnitus that are reversible, that are treatable, and others are not. So when we start looking at tinnitus, first we need to diagnose the source of the tinnitus. Is it due to an external ear issue, middle ear issue, inner ear issue, brain issue? So diagnosis comes first, then we could talk about treatment possibilities.
So how do you diagnose?
History, asking you questions about how is it, where is it, and so on. Examination, and certain tests of your auditory function. Sometimes scans are necessary, MRI scan or CAT scans. Once a diagnosis is reached, then we will talk about treatment options.
So what's the most common type of tinnitus and treatment that you usually diagnose and are able to prescribe?
The most common and what brings most people in is what I call the garden variety tinnitus, which is due to just degenerative changes in the hearing system over time, over age. It is associated with different degrees of hearing loss, and that's the type that unfortunately so far we have no treatment for. But it doesn't mean that we cannot help. Tinnitus can be managed either with audiological means or pharmacological means, which means medications, pills, and with psychotherapy means to help control the impact of that tinnitus on the patient's mind because of the strong negative effect that it could have on you. Some people get very depressed because of tinnitus, and we have to manage that type of a reaction as well.
So are there some things that I can do to help deal with the condition?
Well, first, we need to check you up to make sure where is the tinnitus coming from and whether it's a reversible or treatable source. If your tinnitus is due to fluid in your ear, for instance, we will drain that fluid and your tinnitus will go away. If your tinnitus is due to a condition like Meniere's disease, for instance, we're going to treat the Meniere's disease and reduce that tinnitus or make it go away. But if your tinnitus is due to just degenerative changes, then we're going to talk about either supplements, audiological means such as masking, and masking means put in sound, listening to sound that is coming in to your ears, to your head, that would mask the sound of the tinnitus so you're not listening to it all the time. Or use some medications. And in the medication realm, you have medications that are non-prescription medications, supplements type, and you have prescription medications. So we have options.
Great, thank you so much. I'm glad to hear that there's something we can do to help with the issue.
You're welcome.